The spinal nerves arise along the spinal cord from the union of the dorsal roots and ventral roots. All the spinal nerves contain axons of both sensory and somatic motor neurons, and thus are called mixed nerves. Some spinal nerves also contain parasympathetic or sympathetic axons. Most of the spinal nerves exit the vertebral column between adjacent vertebrae. Spinal nerves are categorized by the region of the vertebral column from which they emerged: the cervical, the thoracic, lumbar, sacral, and coccygeal. The spinal nerves are also numbered, starting superiorly, according to their order within that region. So the 31 pairs of the spinal nerves are therefore C1 through C8, then T1 through T12, the L1 through L5, and the S1 through S5, and then the coccygeal. The nerves arising from each region of the spinal cord and vertebral column supply specific regions of the body. A dermatome is the area of skin supplied with sensory innervation by a pair of spinal nerves. So each of the spinal nerves, except C1, has a specific cutaneous sensory distribution. Then most of the spinal nerves are organized into three major plexuses or braids, where neurons of several spinal nerves come together and intermingle. So sa plexuses sila join. This reorganizes the neurons so that the branches of nerves extending from each plexus contain neurons from different spinal segments. The three major plexuses are the cervical plexus, the brachial plexus, and the lumbosacral plexus. The major nerves of the neck and limbs are branches of these plexuses. Spinal nerves T2 through T11 do not join a plexus. Instead, these nerves extend around the thorax between the ribs, giving off branches to muscles and skin. Motor nerve fibers derived from plexuses innervate skeletal muscles, and sensory nerve fibers in those plexuses supply sensory innervation to the skin overlying those muscles. In addition to the major plexuses, the small coccygeal plexus supplies motor innervation to the muscles of the pelvic floor and sensory cutaneous innervation to the skin over the coccyx. So the cervical plexus originates from spinal nerve C1 to C4. Branches from this plexus innervate several of the muscles attached to the hyoid bone, as well as the skin of the neck and the posterior portion of the head. One of the most important branches of the cervical plexus is the phrenic nerve, which innervates the diaphragm. So the contraction of the diaphragm is largely responsible for our ability to breathe. So innervate means it's stimulate. So the phrenic nerve stimulate the diaphragm. So when there's a contraction of the diaphragm, so we have that ability or good ang ato ang breathing. Next, we have the brachial plexus. So this brachial plexus originates from spinal nerves C5 to T1. So ang cervical plexus C1 to C4. So next, ano niya ang brachial plexus C5 to T1. So 5 major nerves emerge from the brachial plexus to supply the upper limb and shoulder. So first, we have the axillary nerve. So this innervates or stimulate the two shoulder muscles and the skin over part of the shoulder. Then the radial nerve, this supply the nerves to all the muscles in the posterior arm and forearm, as well as the skin over the posterior surface of the arm, forearm, and hand. So radial nerve na siya ang na responsible diha. The radial nerve lies very close to the medial side of the humerus in the proximal part of the arm and is susceptible to damage in that area. So if a person uses crutches improperly, so that the weight of the body is borne in the axilla and upper arm rather than by the hands, the top of the crutch can compress the radial nerve against the humerus. This compression can use dysfunction of the radial nerve, so resulting in paralysis of the posterior arm and forearm muscles and loss of sensation over the back of the forearm and hand. This condition, known as crutch paralysis, so subsides if the patient begins to use the crutches correctly. So that's why it is very important that later with your work, you need to instruct or assist the patient in using the crutches, not to add more injury to the injured person itself. The next, third, the musculocutaneous nerve. So this innervates the anterior muscles of the arm and the skin over the radial surface of the forearm. Then we have the ulnar nerve. Innervates two anterior forearm muscles and most of the intrinsic hand muscles. It also innervates the skin over the ulnar side of the hand. The ulnar nerve can be easily damaged where it passes posterior to the medial side of the elbow. The ulnar nerve at this location is called the funny bone. The median nerve innervates most of the anterior forearm muscles and some of the intrinsic hand muscles. It also innervates the skin over the radial side of the hand. Next, we have the lumbosacral plexus. So this lumbosacral plexus originates from spinal nerves L1 to S4. Four major nerves exit the lumbosacral plexus to supply the lower limb. The obturator nerve innervates the muscles of the medial thigh and the skin over the same region. The femoral nerve innervates the anterior thigh muscles and the skin over the anterior thigh and medial sides of the leg. So, sa medial thigh and the skin over the same region ang obturator. Pero sa anterior thigh and medial side of their leg, mauna siya ang femoral. Then we have the tibial nerve. So it innervates the posterior thigh muscles, the anterior and posterior leg muscles, and most of the intrinsic foot muscles. It also innervates the skin over the sole of the foot. Then last, the next is common fibular nerve. It innervates the muscles of the lateral thigh and leg and some intrinsic foot muscles. It also innervates the skin over the anterior and lateral leg and the dorsal surface of the foot. The tibial and common fibular nerves are bound together within a connective tissue sheath and together are called the sciatic nerve. So together, ang kaning fibular nerves, ang fibular o ang tibial, bound together, they are called the sciatic nerve.